trying to make sure we lift this without causing any little tear. One side looks good.
Feel free to ask questions. I will read them out. Good morning, everyone. We're doing a revision rhinoplasty. Welcome to everyone who just joined here in Beverly Hills with Dr. Littner and Dr. Solomon. They've been operating together for over 16 years.
Guys, you know, we do a lot of rhinos. Those of you who followed before, we do maybe about 250 to 300 rhinoplasties a year. I'd say about 40% of those are revisions, like this lady, where they had surgery somewhere else, it didn't go right, and want to get it fixed. And that's actually really common. So, you know, honestly, the best thing to get it done right the first time, obviously. But if you take all the people who have rhinoplasty, it's some enormous number, something like 1 in 5 people who get their nose done, subsequently go back and get it revised. It's always ideal where possible to be able to find the surgeons that are right for you. We think that an invaluable part of that consultative process is, one, making sure that aesthetically you're on the same page, and that for us means doing computer imaging so that we really are able to hear you, listen to you, and then translate that onto your own images so you can see what that looks like for you before you ever go into surgery. And that way you can make sure that both Dr. Littner and I know exactly what you want. Yeah, look at that, guys. Looks like she got plenty of cartilage here, so
Oh, wow.
this is her septal cartilage. Now, it's an interesting visual here, though, because what you see is she's got a ton of tiny little fractures through the cartilage itself. So Dr. Littner wanted to make this challenging for me, make sure that my carving skills are up today, and that through this mess we're able to find something resembling grafts that we may need.
May I ask a question, Doctor?
Please.
What are the little fractures from, or what could contribute to those?
It can be from previous surgery, but it's most likely in the previous surgery when they've gone through. You can see there was a window of cartilage that was taken out at some point. Why they did that, who knows, but they probably elevated and fractured it, but it can happen from trauma.
Thank you.
Good question, Matt. Thank you for asking.
May I ask one more?
Of course. Please.
How much has rhinoplasty evolved in the last 30 years? Because that's when hers was. Is the skill or anything behind it changed remarkably?
You know, it's an interesting question. And, you know, if anything, what we've done is kind of gone backwards. You know, when rhinoplasty first started, a lot of the first people who were doing it through an open technique. And then it sort of evolved for a long period into kind of what you saw with a lot of plastics, where everything became like less invasive, quote unquote, where people were trying to do things through like little windows, which is what basically closed rhinoplasty was. And then what you've seen kind of over the last maybe 15 years is a turnaround with everybody kind of going back to this open approach and recognizing that, you know, preservation of cartilage is really, really important. I think before what you saw is a lot of people in the 80s being much more reductive in the surgery. They used to take out a lot of cartilage, try to make that scoopy nose, and what ended up happening is then you saw 10 years of follow-up on those people and saw that long term that didn't work out so well. You know, people started collapsing, having real issues. So we rely much more on suture techniques, and what I think has really benefited people now is you've had 15, 20, 25 years, 30 years of being able to see follow-up on patients who've had these techniques and really better understand which ones work, which ones don't, and for what reason. And I think that's where you see the difference. Rick, any thoughts beyond that?
That pretty much sums it up.
Good question.
All good questions today. Wow.
Welcome to everyone who just joined.
Surgery's an interesting thing. It's like a pendulum that swings. So we'll go through 10-year periods where we're doing one